Introduction. Fecal occult blood tests are non-invasive tests used to identify trace amounts of blood not visible to the naked eye in a sample of feces or stool. These tests can be performed at your convenience at home. The presence of blood in feces might be an indication of a problem with your digestive system. Causes of fecal occult blood. Blood may be found in feces for any of the following reasons: colon polyps, benign or malignant tumors in the colon, anal fissures, hemorrhoids, infection of the intestine, ulcerative colitis, Crohn's disease, vascular abnormalities in the intestine. Indications for fecal occult blood tests. Fecal occult blood testing is generally indicated for colon cancer screening, anemia, suspected gastrointestinal bleeding. Types of fecal occult blood tests. The different types of fecal occult blood tests are guaiac-based fecal occult blood test. This test involves the use of a test card coated with a plant-based material called guaiac. The card changes color when in contact with small amounts of blood. Immunochemical fecal occult blood test. This test involves the use of an antibody that combines with the globin molecule in the blood and forms a visible line on a test strip. Preparing for fecal occult blood tests. To prepare for the guaiac-based fecal occult blood test, you may need to do the following. Inform your doctor of your regular medications, as some medications may need to be discontinued about a week before the test. Avoid red meat, raw fruits, and raw vegetables 2 to 3 days before the test. Reduce the amount of vitamin C-enriched food in your diet to less than 250 milligrams daily, 2 to 3 days before the test. No specific preparations are needed for the immunochemical fecal occult blood test. Performing the fecal occult blood test. You will be provided with a test kit that contains the necessary supplies and specific instructions. The basic steps are as follows. An applicator from the test kit is used to collect the stool sample and put it into a special container. You will need to collect stool samples from 3 separate bowel movements, preferably 1 day apart. The sample is evaluated by detecting color changes on a test card when the stool is smeared on it, or if the sample is sent directly to the lab for evaluation. The lab may examine the stool sample under a microscope or perform chemical tests. Interpreting fecal occult blood test results. A positive fecal occult blood test result means you have bleeding somewhere along your digestive tract, and additional testing such as a colonoscopy may be recommended to identify the source and cause of the bleeding. A negative test result means no bleeding was noted during the testing period. However, you should follow your doctor's advice regarding regular screening to evaluate your condition. Summary. Fecal occult blood testing is an important diagnostic tool in the fight against colon cancer. Performing the test as recommended by your doctor can help detect cancer or other diseases of the digestive system at an early stage and improve treatment outcomes.